All right, January is Birth Defects Prevention Month, and our friend Dr. Jen Arnold from Johns Hopkins All Children's Hospital is here with 3 very important tips on how we can prevent this from happening. We're talking about all sorts of stuff this morning. There's a great event coming up.
Yes.
Good morning.
Good morning.
Happy New Year.
Same to you. It's great to be back.
We're matching this morning. We love it. From this angle, it looks like we're wearing the same pattern. We are not, but it's close enough.
We're kind of twinsies today.
I know. I love it. I love you, and I love that you're so honest, and you say, you know what, let's talk about, before we get into what January is all about, I asked you when I first saw you, I said, okay, are you a resolutions gal?
I am.
I said, I actually am. What was your New Year's resolution this year?
So my resolution was to actually be better about going to the doctor, to, look out, regular checkups, right? Not because I'm sick, but because it's important to maintain and stay healthy.
Yeah, I mean, I'm surprised to hear you say that. I thought you had it all together, Dr. Jen, but we know as moms, it sometimes is the last thing that gets
Exactly.
done.
We take care of ourselves last because we're busy. Kids are the priority, your family, work, right? And I think doctors and nurses, those of us in the healthcare field, we're kind of the worst patients.
Oh, I get it. I do. Well, talk about being a patient, though. Let's go back to being a mom. And this sometimes I think is maybe a sad topic to talk about, birth defects, because I think we all have anxiety as moms to, am I going to be kind of introduced to this? But there's preventable things that we can do that you want to make sure and get the word out this morning that I think sometimes moms can just forget about.
Absolutely. And I think, while all complications during pregnancy or for the baby are not preventable, there are things that you can do.
Okay.
And so the most important things are, number 1, take folic acid and your prenatal vitamins in general. But
what does that do? What does the folic acid do?
So the folic acid is actually, it's a type of vitamin B that actually helps with, it's in all of our cells all the time.
Okay.
But specifically in a baby that's developing, it helps with neurologic development. So the brain, the spinal cord. And so we know that by having adequate and supplements of folic acid, we can decrease the risk of neural tube defects. So things that affect the brain and the spine.
So is there foods that you can get it through too that we typically don't get enough? I mean, I know you're not a nutritionist, but I'm just wondering, why do we have to take an extra dose of it?
Yeah, so it is available in foods, leafy green vegetables and other things have folic acid. But during pregnancy, there's an increased demand to help that baby develop. And we know that if you can get that right supplement, you're less likely to have those complications. And in fact, again, part of this whole healthy pregnancy sort of recommendations of mine are related to going to the doctor regularly. And if you've had a type of neurologic malformation in your family or in a prior pregnancy, then you might even require higher doses of folic acid supplementation to help decrease that risk.
Do you have to have those prescribed to you then? Like, is it a...
Yeah, your doctor will prescribe it for you. It's still available over the counter, but what's really important for expectant moms to know is to talk to their doctor, because if you need additional doses of folic acid than what might be in a regular prenatal vitamin, talk to them about how to get that, because if you just take a double dose of prenatal vitamins, you might get too much of other vitamins that could also have negative effects.
Oh, lovely.
Yeah, so always talk to your doctor.
Talk to your doctor, all right. You also say getting vaccinated.
Yes. Vaccines are good. They help us to prevent diseases, and there are some infections that can be high risk to a fetus who's developing. And so it's really important for a mom to be able to make sure that ideally she's all up to date in her vaccines before pregnancy, and then there's certain ones that are recommended during pregnancy to decrease those risks. So things like the flu vaccine, things like something called DTaP, which is diphtheria, tetanus, and pertussis. And we know that babies in the newborn period are very high risk of pertussis, which is also known as the whooping cough.
Oh, yeah.
It can be very life-threatening for a newborn because they don't have the immune protection. So it's important to vaccinate not only yourself as a pregnant mom, but also immediate family and friends that are going to be around the baby. Okay,
good to know. And then this is an interesting one, healthy weight.
Yeah.
This is always a touchy one because we're gaining weight as new moms, expecting moms.
Yes.
So what say you? How do you make sure that stays under control?
Well, again, that goes towards healthy eating, regular exercise, talking to your obstetrician about what that looks like if you have any questions. But trying to maintain that healthy weight is key, because we know that, again, if you're increased your weight beyond what's expected or too much, then it could put you at risk for other health problems yourself, which then can impact the developing baby. So things like gestational diabetes, right? We know that, it's a very high-risk situation that can lead to problems with the heart and other things in a baby. So we want to try and maintain that healthy weight, and just overall, talking to your doctor on those regular visits will help to make sure that we're doing everything we can to provide the best environment possible.
You mentioned that word high risk as well. Talk about high risk, maybe pregnancies and newborns that people should, the information that they should keep in mind.
Absolutely. There's lots of different reasons why a pregnancy for a mom might be high risk. And when it comes to those high risk pregnancies, it's important to get the subspecialty care that you need. Many things are not preventable. So while we try to do all these things, take our folic acid and eat and sleep and exercise regularly and do everything that our doctor says, things are out of our control. And so when that happens and you have a high-risk pregnancy, it's really important to see those specialists. One of the things that we have at Johns Hopkins All Children's now is something called the Fetal Care Program. And that is a specialty clinic just for high-risk pregnancies. So whether it's a problem with the baby or mom or both, we can bring all the subspecialists involved together to help decrease the fragmentation that can happen in care. Because, for example, if a baby is born with some type of a genetic condition, right, we know that they may have to see specialists, maybe pediatric surgery or neonatology, maybe it's another type of subspecialist. But they also need to see the high-risk pregnancy doctor, the obstetrician called a maternal fetal medicine doc. So we bring everybody together, including psychologists.
We love when those doctors can communicate. We've talked about that many times, getting everybody on the same page.
Much better care.
Well, as we close here, we're just about out of time, but talk about these conferences that are coming up. They're coming back by popular demand. I know they sell out fast. They're all over the Bay Area.
Absolutely.
What would you want people to know? How can they sign up for these great conferences that like we were talking about, women's health, making sure that you put yourself as a priority?
Well, exactly. So making yourself a priority means doing things for yourself. So A Women's Journey is an upcoming event that is going to be in Tampa, Sarasota, and St. Petersburg, my hometown. So it's a great way to learn more about the things that you can do to keep yourself healthy, whether or not you're pregnant. It's all about women's health.
All right. Well, again, get those tickets fast, though, because I do know those events sell out. Always such a pleasure to have you here. I'm glad that you're doing well on your New Year's resolution. We're halfway in the month.
Taking care of myself, too.
Leave here and go make your next doctor's appointment for your next checkup, okay? So good to see you, Dr. Jen. We'll, of course, put more info on our website, too.